Hi, in this video we'll study what immunological tolerance. Definition: it is the tolerance to the self-antigens by the immune cells. Tolerance is nothing but acceptance of the self-antigens or the antigens which are present in our own body, our own antigens by the immune cells. Immune cells are nothing but B and T lymphocytes. So what happens normally whenever there is an infection or a foreign body invasion, there will be an antigen coming into our body, external foreign antigen coming into our body. These antigens are recognized by B and T lymphocytes, and this immune cells produces antibody against the antigen and immune response is produced. This immune response is very much important. Stay healthy. It prevents us falling sick too often. This is a normal mechanism. What exactly is happening here? There is recognition of antigen by the immune cells. This is the first step. So what happens if there is any self antigens are recognized by B and T lymphocytes? It leads to autoimmune disorders because it produces antibodies against the self antigens and leads to immune response or hypersensitivity reaction and then leads to the autoimmune disorder. To prevent this, our body has this immunological tolerance. That means the self antigens are not recognized by the lymphocytes, but in some cases this immature cells or mutated cells recognizes the self antigen. But what happens when it recognizes the self antigen? This undergo deletion by apoptosis or various mechanisms. So types of immunological tolerance, it occurs at two levels, that is at the central level and the peripheral level. Once at the central level, that means in the thymus and the bone marrow, we try to identify the cells which can recognize the self antigen and we eliminate it by various mechanisms. Majority of the cells which identify the self antigens are removed through central immunological tolerance. But some cells can manage to escape the central immunological tolerance. These are killed by the peripheral tolerance. So now let us see the mechanisms by which we can kill the cells which identify the self-antigen. T cells by apoptosis. When an immature T cells recognizes self-antigen, they are deleted by apoptosis. We all know apoptosis. Apoptosis is a self-suicide, right? So the second mechanism is regulatory T cells. So if a T cell recognizes self antigen, it is converted into regulatory T cells. What is the function of this regulatory T cells? It is the prevention of immune reactions against the self antigens. Now coming to B cells. First one is apoptosis again. Immature B cells which recognize the self antigens are deleted and receptor editing. For example, there is a B cell which recognizes self antigen. We somehow edit the receptors there and new receptors are added there. Now this new receptor do not identify the self antigen. This is how B cells are managed at the central level. Though many of the cells get eliminated, some manage to escape central tolerance. These are killed or silenced by the peripheral tolerance. The first mechanism is energy. That means functional inactivation. Suppose there is a cell which escaped the central tolerance and came to peripheral tolerance. It is a T cell and it identifies the self antigen. Also, so what will be the next step is the production of immune response. But what happens if we functionally inactivate the T cell? It will be not able to produce immune response, right? So this is the energy. That means the functional inactivation of the cells which identify the self antigen, so that they will not produce any immune reaction. Second mechanism is regulatory T cells. This is the third type of T helper cells. So the T helper cells are three types. One is a CD4 cells, CD8 cells and the regulatory T cells. The main function of this regulatory T cells is to prevent immune reactions against the self antigen. The third mechanism, it is apoptosis. To initiate apoptosis, this antigen, whichever the self antigen and this T or the B cells stimulate apoptotic factors like BIM, BID, BAD, fast ligand. These are the apoptotic factors stimulated by self antigen and the T cells. Through the intrinsic apoptosis, these get eliminated from our body. Fourth mechanism is antigen sequestration. That means these are the antigens present in our body, for example in eye or brain, but are never exposed to blood or lymph. That means hidden antigens. But in case of trauma or the accidents, these antigens get exposed for the first time. Now these immune cells treat this as foreign bodies because they never got exposed to them before, right? So it treats them as the foreign bodies and produces antibodies against it, causing autoimmunity. This is about immunological tolerance.